Hello, this is Dr. Rowe from the Tinnitus and Hearing Center of Arizona. I want to talk a little bit about how tinnitus becomes so problematic for some patients. This type of tinnitus really represents a classical fear conditioning response in the brain. And through this fear conditioning, the brain misinterprets the sound as some type of threat. The problem is the brain doesn't know what the threat is. The sound isn't really being identified as coming from anywhere. As the brain keeps checking in with the eyes and the ears, they aren't able to give a definitive response as to where the sound is coming from. So the sound is essentially lurking in the background without any meaning. And in order to protect the patient, the brain starts to activate powerful subconscious alerting systems to help to start the defense mechanism to respond to the threat, starting that fight or flight reaction. And the brain does this by releasing a hormone from the pituitary gland, a hormone called ACTH that travels through your bloodstream, going all the way down to the adrenal glands. The adrenal glands, in turn, are releasing adrenaline, which starts the heart racing, and cortisol, which tightens up the muscles in the body. And the stress response system is then fed back to the brain as a way of building this loop around this potential threat. And what the patient finds is that the anxiety goes up, the stress goes up, the fear goes up. They become increasingly sleepless, despondent, and worn out. Now, these are things that can be worked on, and this is what we focus on in our clinic, trying to address the stress response in the system. Now, bear in mind, as I said, this represents a classical fear conditioning response in the brain. And any of these conditioned loops in the brain can't be broken over time. And when we break this loop in the brain, the stress goes down, the tension, the fear, the anxiety reduce in tandem, sleep becomes better, and life becomes better overall. We're not implying that the sound is going to go away, but what we are saying is what the sound does to the patient can be resolved, and life will become much better. So if you have an interest, please reach out to us, therowemethod.com. Thank you.